The basic principles of physio are that we get people back to full function and full movement after an injury or illness, and we can do that through various modalities, things like electrotherapy and acupuncture, but hands-on treatments and things like exercise and advice and education. Winter sports injuries that we see mainly aren't particularly different to summer injuries, but what I would say is that we see probably more acute injuries. So acute injuries are things that happen there and then, bumps and bruises and strains and sprains, things like that, versus the chronic side of things, which are more overuse. We tend to see more acute injuries from winter sports. When it comes to winter sports injuries, I don't think people necessarily prepare enough, probably because we're not a nation of winter sports. And I think what people tend to do is they'll go on holiday to go and find their winter sport, so they'll go away for a short period of time. And I think people often assume that if they're fit and well and they do a lot of sports anyway, that fitness will transfer across to winter sports, but it doesn't necessarily. And I think with the 10.4 million people from the UK that are going to go and do winter sports this winter, most of them aren't going to prepare before they go. So there are things they need to think about in preparation. Comparing skiing injuries and snowboarding injuries, we probably see more skiing injuries, but that's just because more people ski than they do snowboard. Having said that, your incidence or your chances of getting injured are greater if you're a snowboarder, probably twice as likely. I would say the injuries are different between skiing and snowboarding. For skiing injuries, we tend to see more knee problems, so 40% of skiing injuries are going to involve the knee, and most of those are ligament injuries. Whereas for snowboarding, you're more likely to get a wrist problem, a hand or wrist problem. And the pattern that we tend to see is that if you're a snowboarder, whatever foot you've got forward, you're going to damage your opposite wrist to that. So that's the general pattern that we see. The difference between a strain and a sprain is just the part of the body that's injured. So sprains relate to ligaments and strains relate to muscles. So a ligament goes between two bones, and we all know what muscles are. If you're worried about an injury taking part in winter sports, there are things that you can do to minimise your risk. I think the most important thing if you're going to be involved in winter sports, especially if you haven't done it before, is to think about having lessons, because one of the big things is learning how to fall. So if you're taught how to fall properly, you're less likely to injure yourself. Think about the type of equipment, so not just the equipment that you're going to be using for your skiing or snowboarding or skating, but think about protective things like wrist braces if you're a snowboarder. And think about your own levels of capability. The chances are if you try and push yourself to your limits, you might just find them, because people tend to get a bit more confident as time goes on, and they might not necessarily have the skill base for it. So just be aware of your own capabilities and think about things like fatigue levels. What we tend to see is that there are certain days and times of day that people get injured. So if you're going away for a week maybe, then the third or fourth day of the day you're more likely to get injured, and towards the end of the day you're more likely to get injured. So perhaps take a break day at some point in your holiday. I think one thing people need to be aware of if they do get an injury, particularly with their wrist or hand, is that sometimes injuries can be more serious than you think. It's one thing if you've got a leg injury, you might not be able to take weight on that leg, so you know there's something serious going on, but people don't always appreciate that for wrist and hand injuries, and you can sometimes have quite a nasty injury but not really be aware of it. So that's something to just think about when you get back. If you're still having niggling problems, then you do need to get it looked at. If you do suffer an injury, if you're away doing winter sports, I think there's a few things you just need to look out for. Most of us know if it's something major that you need medical help for. You know, if you can't move that side, if you can't take weight, if it looks different to the other side, things like that, if there's numbness. But I think the difficulty with a lot of winter sports is that it's quite intense if you're going to go away and do something like that, and you can't always tell if it's normal soreness from muscle ache or if it's a bit of a niggle and maybe an injury that's there. So I think if you are getting pain or achiness after you've done some exercise, let it settle down before you go again, because even if you've got a little bit of a niggle there, if you go out and try and push through it, then you're potentially going to cause yourself a more major injury. So don't try and push through any niggles or pains really. As a physio, I'd say that there's a lot of important things to do before you go with regards to pre-season conditioning. There's kind of two stages. There's the 6 or 8 weeks before you go, where you can get some advice from a physio about specific strength, core stability, flexibility exercises. And these need to be specific to the sport you're going to do. So you can look up exercises to do, but what a physio can do is give you exercises specific to that sport. They can also give you postural and balance exercises, which is really good from a body awareness point of view. If you're going to go onto a slippery surface, it's good to have good body awareness. And then, of course, from a more immediate point of view, just bear in mind you want to do warm-up before you are going to go and do some sport. A lot of the time people have sat on a chairlift or sat in a car or a bus before they go and exercise. So just do 10 or 15 minutes warm-up exercise just to prepare your body for exercise before you go onto the slopes. Another bit of advice I would give people is to think about the shoes and what you're going to wear when you're not doing your sport, because a lot of injuries that we see aren't related to the sport that people are doing. They happen when people go out in the evening. So take your sensible shoes with you. But above all, enjoy your winter sports if you're going to do them.